So you have a procedure scheduled at your local dermatologist, and you kind of want to know, how do I prepare for this? So the very first thing you do is understand the diagnosis that led your provider to recommend the treatment. So we have a lot of videos that talk about different diagnoses. So please watch those videos, but more importantly, please also talk to your local dermatologist so that you know what the diagnosis is. Then you also need to know your treatment options. And again, we have a lot of videos on different treatments that are done in a dermatology office. So please watch those videos. But again, please talk to your local dermatologist to make sure that the procedure or the options for procedures that your dermatologist has recommended is right for you. You need to know the risks, the benefits, and the options for everything so that you can make an informed decision. After that, your local dermatologist is probably going to recommend a specific procedure that you have signed off on. So after you watch the videos on what that entails, these are some basic rules for how to prepare for a dermatology procedure. Now, number one, please make sure that anything we talk about in this video fits with what your local dermatologist recommends. So the last thing we want to do is recommend something that works for my clinic but doesn't work for the clinic you're being seen in. Usually you want to eat a normal meal before you go in. The vast majority of the times that a procedure is done in a dermatologist's office, you are not under general anesthesia, meaning you don't have a tube down your throat and you're not knocked out. You're awake and you're able to talk the whole time to your dermatologist. So we want you to be comfortable. And we want you to eat beforehand so that you don't have low blood sugar or you're not just constantly thinking about getting food afterwards. So eat as you normally would. Now, please wear clothes that you don't mind if they get dirty or stained. Please do not come in your Sunday bests because chances are you could get cleaning agents on them or blood or other things on them, and that could ruin your clothes. You do not need to come in like you're going out for a 5-course meal. Just come in comfortable clothes that you can easily take on and off. A button-down shirt is usually best so you don't have to pull something up over your head. And have it be something that you don't care if it gets stained. Now, the other thing is we often recommend you being as comfortable as possible when you're in the clinic. So please bring a book, bring something to read, so that if there's some wait time, you have something to occupy yourself with. Please also consider bringing a companion into the office so that you have somebody for emotional support and to drive you to and from. Please make sure that you know what supplies you need at home after the procedure. So ask your local dermatologist so that you don't have to go from the procedure to the pharmacy to pick up a bunch of supplies. You already have them at home. Another great idea is to ask for the post-procedure handout so that you know what you need to do to take care of this afterwards so you can read it. And while you're in the clinic, you can ask questions, anything that doesn't make sense. Now let's talk about over-the-counter medications and prescription medications because we get a lot of questions about this. So the general rule of thumb is if somebody has prescribed, if a physician or a nurse practitioner or any sort of provider has prescribed that you take a pill, whether that's over the counter or that's actually a prescription, you keep taking it. You don't stop those. So if somebody has recommended you take a daily aspirin, then you keep taking the daily aspirin. Now, please let your providers know so that we can prepare for that. But if you just take a daily aspirin because you think it's a good idea, then stop those 2 weeks prior. So that goes for supplements as well. So ginkgo, garlic, ginseng, glucosamine, fish oil. Those are kind of the big supplements that can thin your blood and make it so that you could bruise easier after or bleed easier after. So if you haven't been prescribed one of those, stop those for 2 weeks prior. Now, anything that's prescription, obviously it's prescription. A provider has given that to you. You keep taking that. But please let us know so we can prepare. Now, what about the standard aches and pains that happen just from normal daily life. Things like Motrin or Aleve, the category we call NSAIDs or non-steroidal anti-inflammatory drugs. If you have an ache or a pain, you normally take one of those, we'd ask you for 2 weeks prior to the procedure to not take those. Instead, take Tylenol, because Tylenol doesn't thin the blood. Now, please only take Tylenol if you're allowed to. But the basics of this are that if you are prescribed something by another provider, you keep taking it. And if you just think it's a good idea and you're taking it on your own, then stop those for 2 weeks prior. The real thing with procedures is become comfortable. Show up in comfortable clothes, eat a meal beforehand, bring a companion, do all of these sorts of things so that you know what you're getting into, you know the diagnosis, and when you're here, the only thing you have to do is show up. Thank you so much for watching this video. If you found it valuable, please subscribe below so that you can get up-to-date content when it's released. And please share with your friends and family so that when they're going through similar things, they have the knowledge that they need.